Hey everyone, today it's me, Dr. Whimsy. Hi. Today I want to talk a little bit about the importance of minerals and how being deficient in minerals can actually have a powerful impact on your emotional well-being. Now, this is a very old idea in natural medicine and in nature cure. And if you go back to some of the early writings in the natural health movement, you'll see this idea come up time and time again. A really great book, if you're interested in learning about early nature cure, is written by Jethro Kloss, and it's called Back to Eden. And in that book, he talks about the demineralization of processed foods. And he really was onto something, I think. He was writing at a time in American history where the Industrial Revolution had come in, and they were starting to mass produce food and also overly process food. And people who were involved in the natural health community, like Jethro Kloss, started to notice that people who used a lot of overly processed foods, consume a lot of these foods, were getting sick. He noted that they were obese, that they had coronary artery disease, and he also noticed that they started to show emotional decline, and he talked about it extensively. He wrote about this type of processing of food as the demineralization of food and also devitalized. They also used the term devitalized a lot. Two minerals that I do prescribe a lot for people who are suffering from anxiety and depression are, number one, magnesium, which is considered a required mineral. And the second that I prescribe, recently I've started to prescribe it a lot more, is lithium orotate. Now, lithium is not recognized as a required mineral. At the same time, many people who are looking at natural medicine have really started to take note of the powerful effects of lithium on emotional well-being. Lithium is naturally occurring. It's found in food, for example. We see lithium in high amounts in potatoes, but it's also found in natural spring water. An example would be that there's a lithium spring in Ashland, Oregon. My family used to go there, and we would bottle up the lithium water, which tasted terrible, but then we would drink it, and then we would have an improved mood. Now, in higher dosages than you would see in, say, an over-the-counter lithium, which usually runs between 5 and 20 milligrams. But in the higher doses, like 300 milligrams, those are dosages that are used to treat conditions like bipolar disorder. But in people who suffer from mild depression and anxiety, they tend to go with much lower dosages, as I said before, 5 to 20 milligrams. Now, lithium does inhibit the uptake of iodine, and that is something we need to be consciously aware of. It can inhibit the uptake of iodine, and iodine is necessary for healthy thyroid function. And so for that reason, anybody who suffers from hypothyroidism really wants to be careful if they are supplementing with lithium orotate. And of course, like anything else we talk about here on my channel, you really want to talk to your doctor before you take any supplements that we talk about or recommend. Okay, so those are two minerals I just wanted to mention briefly that we see can have a dramatic improvement, can have an impact and an improvement on mood if they're taken: magnesium and lithium, sold as lithium orotate. In the case of magnesium, I often will prescribe it at night prior to going to bed because it has a calming effect, and actually it is sold over the counter in powder form as calm magnesium citrate. In high dosages, it also can help with constipation, so people will sometimes take a teaspoon of magnesium citrate, mix it in a little water, drink it, and then it helps them calm down, go to sleep, and in the morning they can have a bowel movement. Again, like anything we recommend, you want to talk to your doctor before taking it. So those are two minerals that I wanted to talk about that can have a dramatic improvement on, can have an impact on mood, and hopefully if you talk to your doctor, you can begin talking about maybe supplementing those along with the rest of the treatment plan that your doctor has set up for you. All right, my name is Dr. Whimsy Anderson. I'm a naturopathic doctor, and if you'd like to find out more about my work or more about how we supplement to treat conditions like anxiety and depression, you can certainly reach out to me. I'm available both here in my offices in Los Angeles and for general wellness coaching through telemedicine. All that information is linked below. All right, thanks for watching, everyone, and take care. Bye-bye.